The following interviews are patients of mine who didn't want to be identified, and so I'm going to be speaking with them over speakerphone, and we're going to be speaking about a variety of topics, so I hope you enjoy it. So this person, she, a little concerned about her recently because she was doing well for a while. She was on Prestique, Wellbutrin. I also see her, she's on a medication called gabapentin for anxiety, and she was doing pretty well, but then the last time I saw her, she said just things got worse. She just got really depressed again. I had already tried going to the highest dose of Wellbutrin. That didn't really work. And so I started her on a new medication called Auvelity. So let's check in with her now. Hello, how are you?
Hello, I'm doing well. How are you?
Great. So catch me up. How are things since I talked to you last?
100% better. I am feeling so much better. I just can't even tell you what a difference I feel since starting on the medication you put me on. I'm have more energy. I have more hope. I have more joy. I feel like a completely different person. Completely different person.
But probably feel like the same person you used to feel, right? Right? At some point in the past.
Right. Before, yes. I feel like I did about 4.5 years ago before I got diagnosed with breast cancer and went through a divorce. So I've had a rocky time, but I feel like myself again.
Yeah, I've seen you for a while. I know you've been through some very difficult situations in your life here, but
yeah.
So the new medication is called Auvelity, and it's a pretty new one, and it's but I've been pretty impressed by the results with it. So obviously, I had you stop the Wellbutrin, right, and then had you take this instead. How long after how long after you started taking did you feel better?
I honestly, maybe within 2 days.
Wow.
It was pretty quick, and it was marked. Just totally different. No feelings in the pit of my stomach of just anxiety and stress and worry and sadness and like overwhelming, gloominess in my outlook. It just absolutely life-changing.
It's not supposed to work that fast, but see when it works within 2 to 3 days, that's kind of the gauge for me. When something is working within 2 to 3 days, that means it's probably the right dose. Now the company says you take one in the morning for like maybe 4 days, and then you take twice a day. If you're feeling that good that quickly, I'm not sure we need to even go twice a day at this point. Are you? Does it seem to sustain all day and into the evening even?
When I kind of was starting to feel a little bit less, happy or joyous, probably like around 3-ish. So you had suggested that if that were the case, that I should take the second dose. And so I did that today. And I today has been, even all day long. Not that I had any sort of a decrease that was all that noticeable. Just a little noticeable with only one time a day. So going to 2 times a day today, I feel like this is an even better, feeling for the entire day.
Okay, so it's not feeling like too much then.
No.
Okay.
No.
You're going to probably get the full results over the weekend because usually within 2 to 3 days. If you saw that within 2 days of the first one, then the second change like this will be probably the same thing. The peak results will be within 2 or 3 days. if you start to feel like jittery, nervous, maybe take that second one away. But yeah, what's going to happen is it's going to be better because it's going to be from morning to late evening. The staying in the morning only, sometimes it'll start to wear down by afternoon. So this is perfect. Excellent. Well, let's so I'm going to have so you have the samples, right? So I'm going to call the pharmacy to give you a prescription. It's a newer medication, so I'm going to probably have to get the insurance to approve it. So I'm going to work on that on my end to call your insurance to get this, because you definitely need to stay on this. No question. There's really nothing else like this, and if this medication were not available right now, I wouldn't really have had another one for you. I mean, that's why it's so important, because I didn't have a really good backup plan after this, so thank God for this medication. So
thank God.
I know.
Absolutely. Thank God. And thank God for you. Thank you.
Oh, thank you.
For seeing me and getting me in so fast. And
well,
wonderful
experience. It's you're why I love doing this. I love doing this field of medicine because I love the results, and I love you saying that I love seeing people's lives improving, and that's good. That's what gets me up every morning and doing this job, is because when I see people, feeling this way, I mean, there's no greater satisfaction as a doctor to see this with my clients, and because my clients are really my friends, and I look at clients like that. I look at them as family, and that's why I just really enjoy what I do. So, but thank you very much. I really appreciate you talking to me right now.
Awesome. Thanks.
All right.
And I'll talk to you soon.
I'll talk soon. Okay. So in her case, is a new medication called Auvelity. And it's a very unique medication because it actually, it does what Wellbutrin does. It works on dopamine. So that's why I took the Wellbutrin away, because she doesn't need the Wellbutrin with this, because it has the Wellbutrin built in. But there's another element. It's based on dextromethorphan, which is actually cough syrup, but it's called an NMDA inhibitor. So what it's also doing is boosting the level of glutamate. So there's this chemical, or GABA and glutamate. Are the chemicals that go off balance here, and so really it's that boosting of glutamate. It's completely unique. There's no other medication that does this on the market. So I have seen with really tough patients, what we call like treatment-resistant patients who get better, like her, and then they're not better. And I've seen this medication really at dramatic results. She's not the first person I've seen these results with, but it's extremely dramatic medication. I'm glad it's on the market now. It's expensive, but that's why hopefully with her insurance I can get it approved. So that's a great outcome right there. Love to hear this for my patients. So in her case, I recently saw her have her on a combination of Pristiq, Wellbutrin, Vyvanse, and Adderall. She also has ADD, but she was kind of feeling depressed, and motivation was down. And so what I did is I kicked up her dose of Wellbutrin to the highest dose. And let's see, she's also on the medication Topamax. So let's see how she's doing now. Hello.
Hi, Dr. Kona. How are you?
Good. How are you?
I'm doing good.
So tell me what's happening since I talked to you last.
Not much. I just went to go pick up some of my meds the other day. They gave me, I believe, a 90 supply of, a Pristiq, which was really nice. I'm glad I got that.
Mm-hmm.
They, for some reason, I don't know why, they canceled my Topreg, but then they uncanceled it, and then they gave it to me. I was having some trouble with that.
Okay, so you didn't stop the Topamax then, right?
No, I didn't.
Okay, good.
Still going back, and that's been working perfectly.
And that's keeping that's keeping your migraine headaches under control?
Yes, I haven't had any issues with that.
Good.
Ever since I've been taking that. So everything's going good. I do need a refill for my Vyvanse and my Adderall,
Okay.
so for this coming month.
We can do that. And I think I kicked up, didn't I increase your Wellbutrin dose to from 300 to 450? Did that help?
Oh, yes, and I also do need another prescription because I ran out, because they gave me, I think, a 3 month for the 150 a couple months ago.
Okay.
So I just got of that one. So we need the 150 of the the Wellbutrin.
Right. Okay.
But the other one I have right now is the 300. I just picked up.
Good. Good. So you're on the the Prestige Wellbutrin Topamax, right? And that's
Yeah.
good. And how, mood-wise, things are at a good place?
Yes, they're doing very, very good.
Good.
Never been better, actually. Very good. Thank you.
Sure. All right. Very good. Thanks for coming on, and I'll be in touch. Yeah, I'll take care of any of the refill things. We'll take care of that from my end. Okay.
Okay. Thank you so much.
All right. I'll talk to you soon.
Okay.
All right.
You, bye.
So in her case, it took a little bit of time, a few visits to figure her out. So she's on a very common combination. Remember what I call the dynamic duo of medication is Prestige Wellbutrin. So we got serotonin, norepinephrine reuptake inhibitor, boom, and then we have dopamine and a little bit norepinephrine with Wellbutrin. And then we have Topamax, which works on GABA. And that's really good for getting rid of migraine headaches, which she had. It's a very interesting medication because it also can help with not only headaches, but also anxiety reduction and also weight loss. So people are really like this feature of Topamax is that basically it curbs the desire for sugars and carbohydrates. And so a lot of people do like stress eating, especially in the evening. So what I do often with Topamax is give it in like the early evening before that happens, and it just knocks that out. So people are much more able to stick with a better diet. And then they also say they sleep better. It helps them relax at night. So it's a really good medication. I prescribe a lot of it for now, like over 30 years. I've been prescribing Topamax. But this weight loss quality is really not typical with some of these medications. But the ones that it works that helps with weight loss is Wellbutrin, Topamax, and then ADD medications like what she's on. So she's on a combination of medication that keeps her weight under control. So I recently saw this woman. She was pretty bad off when I saw her. I'd seen her only the one time. Depressed, anxious, irritability. I gave her an emotional support letter for getting a dog, which I do a lot of. Irritability, anger, so poor motivation and energy. So a lot of muscle aches and pains. I also asked about her appetite, and she said she definitely is eating too much, and she, especially in the evening, like I was saying before, she was having a lot of emotional eating issues, and so she was just pretty much all around miserable. And so I started her on some Cymbalta. Well, she was already on 30 milligrams from another doctor, so I kicked it up to 60 milligram on that, and then I added Wellbutrin, and then I had her call me back, and then over the phone I put in some Topamax. So let's see how she's doing now.
Hello, how are you doing?
Good. How are you doing?
I'm good.
So catch me up. How are things doing for you?
They're going well. They're going real well. I'm in Maine right now. We're just kicking off our reunion weekend.
Oh, wow.
Things are feeling really well, yeah.
We're reunion for what?
For college, my college 30-year reunion.
Oh, how fun.
College.
That's great.
Yeah.
Ooh, I'm thinking about lobster now that you said Maine.
I know.
Lobster rolls sound good.
Yes. Yes, indeed.
So last time I talked to you, you were on a low-dose of Cymbalta. I increased it. I added Wellbutrin, and then I talked to you on the phone. We added Topamax. So how's everything working out for you?
It's really good. No, I feel great, and I feel like everything is. It feels like it's stabilizing, and the brain fog has reduced, which is good.
Yeah.
So we had come down a bit from the 100. We backed it off to the 75. So
On
yeah,
you mean on the Topamax?
on the Topamax.
Right.
Yep. So yeah, so it's been now. Let's see. Gosh, has it been another week? Just a week, maybe
Right.
on the back to the 75 or a week or yeah. So, but it feels good. It feels good. I remember I did like the 100, but I'd only been on it probably a few days before we backed it off again to the 75. So not sure, how long it would make sense to keep on that.
It's hard to say. I mean, you might adjust to it. After you adjust to it, I mean, we might want to just try again, going back up after maybe by next week or so. Because sometimes we just have to just adjust, and then we go back up, and then you're fine. But yeah, that's the biggest side effect with Topamax. If we go too high, is you get kind of foggy and spacey, and your hair starts turning blonde. Things like that. How about the body aches and pains of before? Is that better?
It is. Yeah, it really is. The stiffness in my neck and whatnot really has subsided. Of course, I was doing some traveling, which threw it off a little bit, but then it seemed to really was better this last week.
Good.
Having been settled down again. So yeah, I really been feeling good. So
how about the
even at work? Yeah.
Mm-hmm. What talking about work?
Yeah, really got through some stressful situations really well. Just in a more settled fashion, and which was nice. It was more accepting of of how I handled it, which was nice and different. So yeah.
You were mentioning like anger and irritability. Do you feel that's improved?
Definitely. Yeah.
Okay. Good.
Yeah, it's nice. Yeah. So
how about the evening eating issue? How do you think that's improved too?
Very much so. Yeah, I've lost about 10 pounds.
Oh wow. Okay. Good.
So, yeah. It's just really interesting. It's just not the same need to fill every moment with eating. It's just it's just a very interesting change. Whether it was loneliness or boredom or anxiousness, and when I'm busy, I'm just busy. I'm not thinking, oh, I better eat now. I've never. It was always funny because I've never been. I've always wondered about those people who said, "Oh, I was so busy, I forgot to eat." I thought that was such a, that can't be true. I've never known that.
I can't imagine myself either. I love eating.
Yeah, and I still love it. It's not like that's changed, but now I can actually stop and I'm full. I'm like, no, I'm fine. Yeah.
Yeah, it's an important concept with this is that medications don't control you; they put you in control. Mm-hmm. And I think people don't typically understand that. They think, I don't want to be controlled by medications. Well, that's not what they do. People feel themselves. They feel more in control. They feel like Otherwise, when the chemicals are out of balance and things are out of whack, your body controls you, and there's nothing you can do about it. You can try and try and try. But it just then it falls short, and so that's what these medications are trying to get your chemistry just so, and then you become really your old self or the old you, or I call remission. Remission means fully better, and that's what I'm looking for with all my patients is feeling like this is the old me back. I haven't felt this good for a long time, or some people frankly tell me I don't think I've ever felt this good in my whole life, and so.
It's very refreshing to feel like I can just just live more authentically and more,
Yeah.
just more balanced. I can,
Yeah.
I can, the method I was trying to live by, living more, being more, what was what I was doing with my Headspace app,
Right.
and here's so this is still happening a little bit. So mindfulness.
Yeah.
Practicing more mindfulness was hard, and now it's I feel like I can do it more easily.
Good.
It's just happening where I can actually pay attention to and do what I can actually understand what I'm feeling and I can pay attention to what I'm feeling.
Good.
It's
Excellent.
happening. So that's
Excellent. Well, we're going to keep the same. I think the only thing to still kind of play around with is probably the Tope Max, and you got to kind of wait until it gets away that that we call cognitive side effects, which means like difficulty with word finding and just difficulty with foggy, So I mean, if you start speaking like the president or so that kind of thing is to watch for. So all right, well, good. I think we're going to keep it the same, and I'll talk to you probably in a month or so. Sound good?
Okay.
All right, you have a good one.
Great.
Take care.
Okay.
All right.
Thanks. You too. Bye-bye.
So this man, I've seen him for a couple of years now. When I first saw him, very long history of anxiety disorder. He's been on Klonopin, which is a tranquilizer, for like 30 years. And he'd been seeing doctor to doctor, been on several different medications tried. Some doctors said, just stay on the Klonopin. Some said, we got to get you off of it. And so anyways, he's had it. And he has a addiction history, other things too, that we'll see if we can talk about. But anyway, I've been seeing him now. And I started him on Prestique initially. And he did really well with that, a low dose. I then added gabapentin, which is also works on GABA like Tope Max does, but it's a different. It doesn't have some qualities, but anyways, it works on the chemical GABA, which is that fourth chemical I was talking about, and then I've been kind of adjusting the gabapentin. So, and he's actually done pretty well. I think last time I talked to him, we were going to do some more adjustments. So let's see how he's doing now.
How you doing, doctor?
How are you doing? Good.
Good.
So I just told them about some. I know I started seeing you a couple of years ago or so, and at the time, let's see, you'd been on Klonopin for like 30 years until then, and I know I started you on Prestique. You did well on that, and I got you on gabapentin, and I know we've been kind of adjusting the gabapentin. How are things doing now?
I'm doing well with the gabapentin, actually. It's been working really well, and I like that there's not any lingering effects with it. When I take it, it seems to go out of my system pretty quickly, so I'm able to use it, and then it kind of works well. It goes right through me.
What kind of dosing are you doing with the gabapentin right now?
Right now, I'm at 1,800.
Okay. How do you disperse that?
I usually take like 300. I get the 600 milligram capsules, and what I've been doing is cutting them in half. So at about 3:30, I'll take 300, and then I'll take another 300 at about 5:30 or 6 o'clock, and then right at bedtime, I'll take the rest of it. So that's how I've been breaking it up. I don't really take it in the morning because it just doesn't agree with me with the coffee.
Oh, okay.
I'm a coffee drinker, so that I'm choosing to do it that way. But I have taken it as early as 11:30 in the morning when I would have a lot of anxiety, and it works well. I haven't had any problems with it.
And is the anxiety 100% gone?
I can say pretty much yes. It's when I was having my sleep issues, especially and also getting off the Klonopin, I was having really bad panic attacks, as you know. So it was getting around bedtime, I would say about 3:30 to 4:30, I'd start anticipating bedtime, and I'd start anticipating another rough night and the panic attacks and not sleeping, and I'd kind of wind myself up, and I tried everything. I'd go for walks and everything. It was just very difficult. So when I first started the gabapentin, I would start taking it a little earlier, and it kind of took that edge off. It didn't completely go away at first, but now, because I've had so much sleep, and it's worked so well.
Mm-hmm.
I kind of have the panic attacks in the back of my mind now. It's not in the forefront. It's not taking over my life like it was before. So it's been working. It's been doing really well. I think just the more sleep I get, the more confidence I start having with it. It's just overall, it's been helping me quite a bit.
So you're taking 1,200 at night, or how much are you taking in the evening?
Yeah, I started doing that at your recommendation. I started taking a little bit more at night.
Okay, is that better?
So yes, it works a lot
Okay.
better. It kind of puts me into the sleep, feeling.
Right.
And I did share. I think I did share with you. I just recently celebrated a birthday, and I was in Las Vegas. For years, when I would take the Klonopin, I would kind of have to take a nap at night, and I go to bed fairly early anyways. I'm in bed by 10 o'clock, 9:30 sometimes. But when I was on the Klonopin, it was very difficult. If I would go to Vegas and want to stay up late or maybe go to a show, I would have to take a nap because I couldn't handle it taking the Klonopin. But recently I just went and I just kind of pushed everything back 2 hours, the gabapentin, and it worked perfectly.
Perfect.
I mean, it was great. I'd go to bed at midnight, 12:30, 1 o'clock. And it was fine. Woke up the next morning like nothing. So
now,
I'm very happy with it.
How long you've been off Klonopin completely, right?
Yes, for right now, for 3 months.
Wow.
Going on 4 months. On the 15th, it'll be 4 months.
That's amazing. Also, you tell me about remind me about other addiction past you had in the past. What was that? What were you addicted to before?
I've been sober since '87, and I was a heavy drinker since I was 13 years old.
Wow.
I started drinking at an early age. Alcohol was my thing, but when I got into experiencing the '80s a little bit, and I got in my early 20s, I started messing with cocaine. I want to say that I didn't do it a lot. I was very functioning with the cocaine. I worked, had a full-time job. I was a welder. I was a plumber. I worked, so I was always able to do my job. But on the weekends, I would get a little bit of cocaine. I think what I came to terms with is that even though I did have addiction issues with cocaine, I think the cocaine just kept me up longer so I could drink more.
Right.
Kind of what I discovered. And it was just more and more drinking. But in '99, I had been sober about 12 years, but I started having these, now that working with you and I've learned more about it, come to terms with it, I started having panic attacks in 1999. And that's when I was prescribed the first time I was introduced to Klonopin.
Right. Okay.
So
Good.
from '99 to now, and that's been my crutch. That's been very difficult until me and you started addressing it.
Yeah. Good. Well, good. Yeah, I think, like I said, I think the last time I talked to you, I said, we got to be really flexible with gabapentin. You're only at 1,800. That's great. I mean, the maximum dose is 3,600 a day, so you have plenty of room to move it. And the only reason to move it is if you start to see things, the effectiveness going down and the anxiety coming back a little bit, is that you have plenty of room here with the gabapentin.
Right.
You're about half of the maximum dose, so that you have plenty. But it doesn't sound like you're going to need to. Anytime soon. This might be where you stay. But like I said, as long as we have that flexibility and, or if you get any kind of temptation to take the Klonopin, obviously that would be a definite sign to take it,
Right.
for sure. But good. And I think we're just going to continue as is. And it's been.
I think if I could add, the gabapentin's been really good. I've noticed it also with my mood and probably getting out of the cycle with the panic attacks and getting good night's sleep and then not feeling drugged in the morning. That's just overall built on an overall better feeling that I have. I mean, it's just put me in a better mood. I'm a little more productive at work. I'm getting more done around the house. So it's also done a lot of mental health good for me in that regard. It's just because I'm rested, when you're living in addiction and you're living with that, under that control of the Klonopin or the alcohol, it was just, you'd go through some rough periods. I'd go through some rough periods. So I'm very grateful. I'm very happy with the Klonopin and that we figured it out, that you helped me figure it out.
Yeah, if I remember right, I think my best friend referred you here, and so I think he's probably happy how you're doing at work too.
Yes, definitely. He was giving me a hard time today. I was talking to him, so he was kind of giving me a hard time. But we were talking to praise. So
yeah,
I'm very appreciative, Doctor.
All right,
I'm sold. Thank you very much.
All right, well, I'll talk to you soon then. Okay.
Okay. Bye-bye.
Okay. Yeah. So in his case. So he is on, again, Prestique, which is probably my favorite medication to prescribe. It's one of the top ones I definitely prescribe. again, so that works on serotonin and norepinephrine. Like I said, I've found that Pristiq, Cymbalta, Effexor XR are often better than the SSRIs. And then gabapentin works on GABA, just like Topamax does. And so I think he has an imbalance of those three chemicals. And so with the Pristiq and gabapentin, it covers those. And it looks like that's all he needs. He doesn't have a dopamine issue. So that's why that treatment is working for him.